Welcome to Section 8 of Immunodeficiencies. In this section, we'll be discussing severe combined immunodeficiency, or SCID. Let's get started. This scene will take place back during the time of dinosaurs. We can see that a fierce battle has erupted between this guy on a chariot and the T-Rex. Notice that the chariot is turning pretty sharply, resulting in skid marks on the ground. The skid marks should help you remember that this image is all about severe combined immunodeficiency, or SCID. As the chariot turned sharply, we can see that two soldiers have fallen out. One person is holding a T-shaped flail, and the other is holding a bow. These are symbols for T cells and B cells. The fact that they're falling down should help you remember that this is a B cell and T cell disorder. Now we've added a few more warriors to the scene, and you can see that they're beginning to take down this T-Rex. However, he's not going down without a fight. Notice that some archers have been smashed by his head, and there are some broken arrows off to the right. These broken archers and arrows are here to help you remember that patients with this disorder will have decreased immunoglobulins. Next, notice that the T-Rex is falling down because they've captured it in this big net. A net like this resembles the lymphatic system, with lymph nodes scattered throughout the body and connected by small vessels. If we zoom up, we can see that the T-Rex is trying his best to break loose and has broken a few strands near his mouth with his sharp teeth. The fact that it's broken alludes to the idea that there is a problem with the lymphatic system. More specifically, a lymph node biopsy will show a lack of germinal centers. This makes sense, right? If B cells are defective, then somatic hypermutation and class switching, which take place in the germinal centers, will be impaired. We've specifically shown a T-Rex falling down like this to help you think of decreased T cell receptor excision circles, or Tregs. Tregs are byproducts of DNA that can be detected when a T cell successfully undergoes genetic rearrangement while developing the T cell receptor. So if the T cell receptor is unable to form properly, then T cell receptor excision circles will be decreased. And that is exactly what happens in this disorder. So patients with SCID will have decreased Tregs. Patients with SCID will also have absent T cells on flow cytometry. To help illustrate this idea, we've shown a cowardly warrior attempting to escape on the river, but has been gobbled up by this dinosaur. Now all we can see is part of the warrior's hand and T-shaped flail. Also, the raft flowing down the river should help you remember that this part of the image has to do with flow cytometry. So all this together should help you remember that patients with SCID will have absent T cells on flow cytometry. They'll also have an absent thymic shadow on chest x-ray. To help you remember this, we've shown some thyme plants in the forest that should be shaded, but they're not. We can see the light shining right down through the canopy onto these plants. In other words, there is an absent shadow on the thyme. So this should help you remember that patients with SCID will have an absent thymic shadow on chest x-ray. All right, there are two types of defects that can cause SCID. The most common type is X-linked recessive and involves a defect in the interleukin-2 receptor gamma chain. To help you remember this, we've added a guy being attacked by a pterodactyl. He was minding his own business, laying down wooden floors in the treetops and building a hut, when out of nowhere he was picked up and attacked. Notice that he's holding two interlocking wooden floor tiles. This is our symbol for interleukin, which should help you think of the IL-2 receptor gamma chain. Also, when this guy was picked up by the pterodactyl, we can see that the claws made a unique X shape, and this should help you think of X-linked recessive. Together, these ideas should help you remember that the most common defect causing SCID is a defect in the IL-2 receptor gamma chain, and that this is X-linked recessive. The other less common defect is due to a deficiency of adenosine deaminase. This is an enzyme that's necessary for the degradation of adenosine and deoxyadenosine in lymphocytes. If it's absent, then DATP accumulates in lymphocytes and destroys the lymphocytes. To help you remember this, we've added another tree hut where the village dentist lives. We can see that outside of his business, his sign reads Ancient Dental Association. Notice that he's not a very ethically motivated dentist. He sells Reese's to kids all day and tells them that if they eat more candy, then their teeth will feel better. Now a pterodactyl has flown down from the sky and knocked him off of his hut while he was trying to sell that kid some Reese's. Anyway, the Reese's should help you think of autosomal recessive. So together, all these ideas should help you remember that a less common cause of SCID is a deficiency of adenosine deaminase, which is autosomal recessive. Now we can see another treehouse in the canopy. Notice that the woman who lives here is dumping out a bucket full of waste. Yep, that's their toilet, and now we can see her dumping it out onto the little dinosaur predators. These little guys are trying to gobble up some cotton, and the woman needs this cotton to make clothes and such. The poop she's using to scare off these dinosaurs should help you remember that SCID patients may present with chronic diarrhea. The cotton balls were introduced in our Candida image in microbiology and represent the white lesions caused by Candida. In this case, the little dinosaurs are trying to eat them, so cotton balls in the mouth represent thrush. We've included this in the image to help you remember that patients with SCID may present with thrush. As the woman begins to throw down the waste, some of the little guys are scared off and begin to run away. We can see that as they scramble away, some little infectious particles are kicked up into the air. This is here to help you remember that patients with SCID present with recurrent infections. Now we can see why this woman wants the cotton. She needs it to make some clothing for her naked baby. This unattended naked baby on the hard wooden floor is clearly struggling. I guess you could say it's failing to thrive. We've included the crying baby this way to help you remember that SCID patients may present as failure to thrive. Unfortunately, while she was tending to these little monsters trying to eat her cotton, her toddler was trying to quote-unquote help, but we can see that he's really just shoving unnecessary pills into the poor baby's mouth. The pills in this baby's mouth, along with the bottle near the toddler, should make you think of medication and help you remember that patients with SCID should be given antimicrobial prophylaxis. The mother was clearly distracted, but what's the dad's excuse? Well, you can see that he's been busy opening the door and shooing away this annoying solicitor. He's trying to get the people to watch the live animal dinosaur fight going on down below. The dad is worried about his own problems, so we can see him quickly telling the guy to go away. Anyway, the live animal sign that's shaped like a syringe is our symbol for live vaccines. So the fact that he's being rejected should help you remember that patients with SCID should avoid live vaccines. The final adult here that should be helping this poor baby is the uncle. But as you can see, he's got some psychiatric issues he's dealing with. He loves dinosaurs and believes that if he waters this dinosaur bone, then it will grow into a real dinosaur someday. He's clearly hyper-focused on this idea, just staring intently at the bone. Anyway, the bone being planted should make you think of bone marrow transplant. So patients with SCID can be treated with a bone marrow transplant. The other part of the treatment involves giving IVIG. To help you remember this, we've shown some clothespins that look like immunoglobulins. We can see that this little village in the canopy hangs their shirts up here to dry. So immunoglobulin-shaped clothespins for give these patients IVIG prophylaxis. All right, that should be everything you need to know about SCID.